Hi guys, it's a real pleasure and an honour to be with you here today to talk to you about our project around child health hubs. So my name is Matt Southall. I'm the Paediatric Therapies and Special Needs Nursing Service Manager for Central Cheshire Integrated Care Partnership, and I'm joined by Mandip. I'll let you introduce yourself, Mandip.
I'm Mandip Sohan, and I'm the Programme Manager for Child Health Hubs for the Cheshire East Integrated Care Partnership.
So I know I introduced myself as CCICP. We're representing on Cheshire East Integrated Care Partnership as a model across Cheshire East. So without further ado, just in terms of getting into the origins of our project, we were tasked with a bit of a blank page, if I'm perfectly honest. We had some funding that was arranged through the Northwest Clinical Network from a paediatric perspective that was given to us as an ICP with a task of developing some child health hubs, and that was pretty much it, really, to be fair. So when we got our project group together to begin with, what we were really keen to understand is what data we were going to use in order to be able to sort of determine how we were going to take the project further and what kind of information we were using to begin with to develop it. So we've just popped a couple of pictures on there that helped us to generate that initial sort of thought process around where we wanted to work. The Child Health Hub idea was originated from an Imperial Child Health model, which focused around multidisciplinary team meetings between essentially primary, secondary care colleagues in amongst others, that allowed collaboration and communication to promote child health, and to improve outcomes for children. So that was our starting point. In amongst that, we were obviously taking direction from the Cheshire East Partnership 5-year plan that we've mentioned, the Improving Me Foundation, which were the foundation that have eventually funded the project. And that's where we started as a starting point. Next slide, please, Helen, if that's okay. So what we wanted to start with as well was to begin to look at the data on what that was showing us and how we could start to move things forward. So there's a couple of graphs here that we've represented around emergency admission and A&E attendance and the trend for that for children and young people within a 0 to 19-year age range. Of course, we started the project, interestingly, in around about April 2020, which coincided with the beginning of the COVID pandemic. So you can see from some of the data that obviously there's a drop in some of the trend from 2020 because of the pandemic. And what we begin to focus on was obviously the data prior to that, and also starting to look obviously afterwards now. What is clear prior to the sort of the pandemic issue was that there was an increasing trend of the number of children and young people that were presenting both at A&E, GPs, etc., in regards to conditions that we felt potentially could be managed in the community. And this was the starting point for us, was how can we translate some of that data now through into managing in the community a little bit better. Next slide, please, Helen. These are again just some more graphs that represent that. So you can see the general trend of outpatient appointment attendances with that dip into sort of 2020 data, with again the same idea that we wanted to try and move some of the care that was being delivered within an acute setting out into community and make this more accessible for patients, for children and young people and their family to access the care that they need. Next slide as well, please, Helen. So this slide basically talks through essentially what we set out to achieve at the very beginning of the project. So we wanted a whole system approach to children's health. Essentially, we wanted to bring people together, get key stakeholders around the table and join together the silo conversations that have often happened, not just in paediatrics, clearly in healthcare, but having worked in paediatrics myself for a long time, I understand that generally those conversations do quite happen in isolation. So we wanted to bring everyone around the table to join those conversations together. Our real big sort of tagline was around delivering care closer to home. We wanted to make these services more accessible for children and their families, to avoid the trek to sort of big acute hospitals and trying to find your way around those corridors, etc., to outpatient clinics. So we wanted to bring it closer to home and make them more accessible. And linking into that, making sure that we were delivering the right care in the right place at the right time, around that sort of accessibility at the same time. And also looking at new services for new needs. So we weren't just about what can we do with existing services, but actually where have we got gaps within our current service that we could look to develop those newer services to be able, again, to capture those young people and children that we weren't doing at that moment in time. And they were the four main aims that we had at the very beginning of the project. Ultimately, we were tasked with trying to reduce ED attendance and emergency admissions and general sort of paediatric referrals that were going from paediatric into secondary care. And that's where we're going to start to take that on from now on the journey. I'm handing over to Mandy. I think that's right.
Yeah, that's great, thank you. So last year, towards the end of year one, we were asked to produce a roadmap of what we had accomplished so far. So this is really just a highlight of some of the big ticket things that we managed to accomplish in year one. Personally, I'm very proud that in August and September of last year, we actually circulated a service user questionnaire. And we didn't have high expectations, but we actually achieved 136 responses, which we're really, really pleased with. Next slide, please. So over the last year, we've developed 3 clinics and piloted an MDT approach. The clinics have seen 360 children and young people between them, and the retrospective MDT has discussed 52 cases. When I think back to our first clinic in November and all the preparation that we did beforehand, ensuring that referral forms were adapted, there were changes in booking appointments, parent information leaflets, etc., to where we are now, I feel a real sense of pride that we've accomplished so much in such a short amount of time, and we've done what we said we would do, which was establish 2 child health hubs in Crewe and Macclesfield. Next slide, please. So, as a service, it's new. We're welcoming feedback, and we want to know what else we can do that's going to improve the services that we offer. This slide is just a demonstration of some of the feedback that we've received from our parents and clinicians. And we will again later on this year be circulating another service user questionnaire to try and understand what more we want, what more is wanted, needed, and how we can help facilitate that and make our hubs an inclusive environment so that people can come along and their children can be getting the best start possible in life. Next slide, please. So 2020, a very different, a very difficult year. For Matt and myself, we were setting out on this really ambitious project. The child health is an ICP target area. And we, just like everybody else, faced some real challenges. So COVID-19 aside, the impact that had then on workforce, estate, time, all of that we had to sort of adapt to, continuously adapt to with our stakeholders. We were meeting outside of meetings, we were making ourselves available to have really complex discussions. And I suppose this is where we really benefited from having an integrated care partnership, because when we faced challenges, we were able to lean on partners and they were able to give us solutions that we perhaps wouldn't have considered in what I would say normal times. We were just able to really lean on each other. We've accomplished so much. We run our clinics out of children's centres. We use the consulting space that's available there, taking parents and children and young people out of the chaos of a hospital environment and giving them a really nice community setting. No doubt everybody's faced these challenges, but I think we, as a project group, are really proud of the fact that we've got such great integrated care partnership working around us at this moment in time. Next slide, please. So year 2, so we're partway through year 2, and what are we doing? In March of this year, we had a workshop where we were doing our planning for year 2, and we were asked to increase the scope of our project to include maternity and obesity and amongst other things. So I'm really happy to say that in October, we'll be launching a perinatal mental health wellbeing programme for low to moderate risk women. We've recently started to circulate some universal asthma training. We've got our GP practices are receiving educational sessions. We are hoping to establish a obesity pilot to bring a secondary care model for healthy weight management in children. In October, we'll also be launching the prospective joint MDT meetings across the east of our region. And we're also, the success of one of our clinics, the Unsettled Infant Clinic in South Cheshire, will be going across into East Cheshire as well. So that will be happening in October. Again, amazing accomplishments. Throughout all of this, we've been continually learning, gathering information, sharing and feeding that back to all the stakeholders and moving everything forward. And I think the project itself is just such a great testament to what can happen when there's a lot of people involved with different ideas and bringing a lot to the table. Next slide, please. So we took a gamble and we've developed a year 2 roadmap. We're hoping this is how it pans out, but again, this is just a really high level view of what we hope to accomplish this year. A lot of it we have already done, and we've got a lot to look forward to, working very closely with our clinical leads to support the development of our child health hubs. And I think the one after this is pictures. So yeah, so just want to leave you, we've got 3 slides of pictures that we've had over the recent months. Some of them are our clinical staff in the consulting spaces, and in July we held a ASD market stall event, and these are some of the pictures from there as well, where we brought partners together so parents and children and young people could visit and get information from different healthcare professionals. Thank you.